Hello, this is Dr. Do again. This video is continuously with the systemic approach of medicine. Basically, I move on from the different level of the structures, from the invisible to the visible, and move on to the tissue-related diseases. I have talked about epithelial tissue-related diseases and also the connective tissue-related diseases. Today continues with the connective tissue-associated diseases. Talk about the fibrosis, which is associated with the connective tissue, fibrotic connective tissue, which is probably, I think, one of the most widely distributed in the body because the different kind of fibers, either reticular fibers or the elastic fibers, for example, they form in different structures, carry out different functions. For example, the healing process, fibrosis, through this fibroblast laying out the fibers to heal, forming the scar. So that's one of the major mechanism for repairing in many organs and tissues. So and this overreacted or some of the organs can regenerate. For example, the epithelial, the superficial of the skin injury without a scar because of the basal cells of the epithelial lining on the skin can serve as the stem cells. It's not, but it can just keep producing new cells in the cycle, pushing up. So that's why we have the flakes falling off, because of the new cell growth and push off the old cells and dead cells. And some other organs also can repair with limitations, not means completely. For example, the nerve fibers from the peripheral tissue, like you cut your fingers, you will not lose your sensation because of the peripheral tissue fibers also have this capacity to regenerate, to repair it without any problems, unless it's the injury was massive, involved deeper, and also involved the neuron itself. So these are the organs can repair without a scar. That's the examples. But some of them, like the internal organs, they can regenerate, but just limited. Particularly for those chronic disease caused damage, so the organs will repair it, regenerate, and with limitations, and then eventually ending up with the fibrosis. So the inflammation and the fibroblast to laying out the fibers to seal and to heal. So this is about the example for those fibrotic connective tissue associated diseases. That's just very common fibrosis of the organs, like liver, for example, cirrhosis, that's just different name, or interstitial lung diseases caused by different etiologies. Eventually, the interstitial tissue, which are connective tissue, majority of the fiber tissue, take over the normal alveoli or normal parenchymal cells of the lung. So that's just another example. And all the other, like the kidney, for example, with the long-term chronic kidney disease, eventually the kidney will undergo the same process, loss of the nephron, which are the function unit for the kidney, and then replaced by the fiber or scarring tissue, which the process undergoing fibrosis, just different name. So this is about the fundamental knowledge of this fibrotic connective tissue associated diseases. But as I mentioned, this fibrosis process, the fibrotic tissue play important role in the body homeostasis to regulate it. For example, like I mentioned, the skin injury or the nerve fiber injury can regenerate, and also sometimes if the skin injury is deeper, then what the body can do is use these fibers to heal it as a scar. And this process in the heart, for example, even though the very common example like cardiomyopathy infarction, okay, so the ischemia caused the localized the muscular cells of the cardiovascular cells lost the function, lost the capacity to repair, then what happened? The fibrotic, those fibrosis lost without the normal function, however, can stop the bleeding, can maintain the heart still function. So that is the good part of this fibrosis. The good function of the necessary function for this fibrotic connective tissue probably is confused. And also around the joint there are some of the elastic fibers, and also around the muscle. The elastic fibers, they are serving to cushion and also increase the flexibility or elasticity of the tissue of the joint. If those if those fibers undergo inflammation, then replaced by the other kind of fibers, then cause the fibrosis of the joint, increase the stiffness of the joint. So that's probably the underneath of, we talk about the arthritis, morning stiffness or etc. because of those fibrosis process limited, narrowed the space between the joint. So that's another fibrosis or fibrotic tissue associated diseases. So this is very, I think it's kind of here, there, scattered, just give you some idea, some clinical process or some visible diseases can, or visible process is really, the mechanism is because of this connective tissue called fibrotic connective tissues. And talk about the cirrhosis of liver, which is the liver parenchymal cells replaced by the fiber scars. The risk factors, I think I've mentioned so many times, either the hepatitis B or hepatitis C infection chronically, or the too much fat can deposit there, causing the chronic inflammation and may cause the cirrhosis, and also the alcohol, the chemicals, or the medication toxicity, or the chemicals like alcohol can cause this cirrhosis. So this is and I mentioned, I think I talked about the hepatic cirrhosis in terms of the risk factors and also the management and the complications, and also for the other important, I think, fibrotic connective tissue associated diseases I can think is the chronic interstitial lung diseases and chronic interstitial kidney diseases. Those are similar mechanism, but the etiology are different. Basically is the connective tissue, the mesenchymal cells, not parenchymal cells, and also the fibroblast cells laying out extra fibers to take over the unfunctional, dead or diseased nephrons, like unit, or the alveoli in the lung, or nephrons in the kidney. So that is and eventually the organ will shrink because of this fibers just drew together, like make it hard and also shrink in size. So this is, and that's probably the end stage of this chronic interstitial lung diseases or chronic interstitial kidney diseases. Those are all associated with this inflammation and associated with this fibrous connective tissues. So this is something I can think of, but I think this is just no here or there. It's kind of, but basically for the fibrosis of the organs and caused by the chronic process and the risk factors I have mentioned before. I hope it just helps or remind you. Thank you for watching. I will see you next time.